Welcome to the Hemp CBD Clinical Significance section. It seems that everywhere we look, CBD is being marketed as a cure-all supplement for almost any ailment, and it's being sold in almost every dosage form imaginable. When it comes to patients choosing over-the-counter hemp CBD products, it is important to understand exactly what clinical evidence exists supporting the use and recommendation of CBD products. We are limited with the clinical studies on CBD currently available due to the continued Schedule I status of cannabis in the United States. However, we do have some clinical evidence which shows CBD to be a promising agent for seizure control, inflammation reduction, anxiety reduction, as an antipsychotic, and as a possible treatment for inflammatory and neuropathic pain. The best clinical evidence for CBD comes from the clinical trials of the prescription drug Epidiolex, which is an FDA-approved cannabis product which contains 100 milligrams of CBD per milliliter and is used to treat rare forms of epilepsy in children. These clinical drug development studies firmly established the role of CBD in epilepsy treatment. Another powerful study published in the American Journal of Psychiatry looked at doses of CBD versus placebo and its effect on positive psychotic symptoms. After 6 weeks of treatment, compared with placebo, the CBD patients had lower levels of positive psychotic symptoms and were more likely to have been rated as improved and not as severely unwell by the treating clinician. These findings suggest that CBD has some benefit in patients with schizophrenia. Several smaller studies have looked at CBD's effect on anxiety and pain and inflammation reduction as well, but often these studies are conducted with cannabis containing both CBD and THC, making it difficult to determine which cannabinoid has contributed to the clinical effect. The fact remains that these 4 conditions have the best body of clinical evidence supporting the use of CBD for treatment, and claims made regarding the use of CBD to treat anything from psoriasis to cancer are largely clinically unfounded. Once you have determined whether or not a hemp CBD product might be useful to you or your patients, the next step comes in choosing a product. Unlike traditional pharmaceuticals where the strength per dose of medication is listed on the bottle, typically, over-the-counter hemp CBD products are labeled by the total milligram of CBD found in the entire bottle. This is very misleading and confusing to both patients and practitioners when it comes to understanding what amount of CBD they are actually consuming per dose. The labeling of CBD with milligram per bottle can also make it challenging to understand how cost-effective an individual product is. The math must be done to divide the total milligrams in the bottle by the number of doses to get an accurate idea of exactly how much you're paying for each dose of CBD. This graph shows a variety of hemp CBD brands and their associated cost. As you can see, the total number of milligram varies widely per product, as does the price per milligram of CBD when the cost is broken down to the number of doses found within the bottle. As you can see, Epidiolex, the only FDA-approved CBD medication, lies somewhere in the middle as far as cost per milligram of CBD. This is contrary to several media reports that Epidiolex has been grossly inflated in cost, when the actuality is that large concentrations of CBD found in Epidiolex makes it very affordable when it's broken down to the cost per milligram. It is very important to educate yourself and your patients on how to best determine the cost-effectiveness of over-the-counter hemp CBD products. The dosing of over-the-counter hemp CBD products can also be a challenge. In clinical studies, The dosing of CBD has ranged from less than 1 milligram per kilogram per day up to 50 milligram per kilogram per day, with the majority of studies reporting an average effective dose ranging around 10 to 20 milligrams per kilogram per day, depending on the specific disease state and patient population studied. For an average 60 kilogram person, that math works out to an average dose of 600 to 1200 milligrams of CBD per day. A quick look at most over-the-counter hemp CBD products will show that doses tend to range around 5 to 20 milligrams per serving, meaning that 60 kilogram individual would need 30 to 60 doses of most over-the-counter hemp CBD products to get anywhere near the suggested clinically effective dose. This is not to say that lower doses of hemp CBD may not be effective. It simply means we do not have the clinical evidence showing whether or not they are. It is also important to manage patient expectations by letting them know they might need a much higher dose of hemp CBD than expected in order to see a clinical effect. Another issue to consider is the associated cost of these higher doses of hemp CBD for the patient. As shown on the previous slide, the cost per milligram of hemp CBD ranges fairly widely. On average, a product that costs about 12 cents per milligram of CBD will result in a patient cost of $72 a day if they need a daily dose of 600 milligrams, making these products extremely cost prohibitive to patients who need higher doses to get a clinical effect. An additional topic to consider when looking at the dosing of hemp CBD is the actual dosage form of the medication. Many hemp CBD products are in oral delivery systems, such as candy, beverages, or other food items. CBD has been shown to be only about 20% bioavailable through oral consumption. This can make finding an effective hemp CBD dose using an oral delivery system very challenging, as it is minimally absorbed by the body. Further information on dosing and dosage forms can be found in the pharmacology module of this certification program. In addition to the high doses of hemp CBD needed to show a clinical effect, research has also shown that when dosing patients with CBD alone, it exhibits a bell-shaped dose response with no additive effect shown at higher doses. We do not see that same bell-shaped response with full-spectrum medical cannabis containing both CBD and THC. This graphic is from a preclinical study in which serum levels of tissue necrosis factor alpha, a known pro-inflammatory cytokine, were measured in rodents that had inflammation induced in their paws. When dosing CBD by itself, the bell-shaped dosing curve is very clearly shown in the graphic, with increased dose showing no improvement in continued decreasing levels of tissue necrosis factor alpha. However, treatment of the same condition with a full-spectrum medical cannabis medication shows a continued decrease in tissue necrosis factor alpha levels with higher doses of the cannabis medication. It also seems in clinical studies that using whole-spectrum medical cannabis results in much lower necessary doses to show a clinical effect than with using CBD isolated from hemp. These are all important things to consider when recommending different cannabis products to your patients or asking any questions they may have about why a full-spectrum medical cannabis product may or may not be of more benefit to them than an over-the-counter hemp CBD product. It is also important in helping patients understand why a medical cannabis product may work for them if an over-the-counter hemp CBD product did not. As with any treatment, the goal of hemp CBD dosing in patients is to find the lowest effective dose, both to mitigate the cost to the patient and the medication burden. Best practice is to begin with the lowest known clinically effective dose of 1 milligram per kilogram per day in 2 to 3 divided doses, and to increase that dose slowly every 3 to 4 days until the desired clinical effect is reached. It is important to note that low doses of CBD may be stimulating. If this is an undesirable effect, the dose should be increased to 10 milligram per kilogram per day in an effort to bypass the stimulatory threshold. If doses greater than 10 milligram per kilogram per day are needed, or no clinical effect has been seen after titrating the patient up to that level of dosing, consider switching the patient to a full-spectrum medical cannabis product if available for a more cost-effective treatment option. When it comes to side effects, CBD is a fairly benign medication. As mentioned, it can be stimulating at low doses and may cause some sedation at high doses, but this is widely variable based upon individual patient response. CBD has also been shown to be immunosuppressive at high doses and should be avoided by patients with any sort of immunodeficiency. Loose stool and loss of appetite are the second most common symptoms associated with CBD use after sedation. Liver toxicity is also an area of concern with hemp CBD dosing. About 10% of patients taking CBD in studies had transient increases in their liver enzymes, which could indicate potential liver damage. About 2 to 3% of individuals taking CBD actually had to discontinue because their liver enzymes went so high it was of concern to the people running the study. In the fourth quarter of 2019, the FDA has issued several warnings about the potential of liver toxicity with hemp CBD use, and further studies are needed to fully understand this mechanism and whether or not it poses a threat to patients. It is worth noting that this elevation in liver enzymes has not been seen in studies of full-spectrum medical cannabis products. There are several different drug interactions that have been clinically associated with the use of hemp CBD products. Enzymes produced from the cytochrome P450 genes are involved in the synthesis and metabolism of various molecules and chemicals within cells. These enzymes are primarily found in the liver, and CBD inhibits 3 of the main cytochrome P450 enzymes, which may result in increased concentrations of other medications which are metabolized by these enzymes. These sorts of interactions are typically only clinically significant when the drug involved has a very narrow therapeutic window. Several anti-seizure medications fall under this category, so extra caution should be used when giving any sort of hemp CBD product to a patient on anti-epilepsy medication. A good rule of thumb is to dose CBD cautiously with any medication that also interacts with grapefruit juice, as CBD and grapefruit juice both inhibit the same cytochrome P450 enzymes. It is important to note that these drug interactions are rarely clinically significant and can be successfully mitigated through slow dosing titration of hemp CBD over time. In summary, you should always use caution when recommending over-the-counter hemp CBD products. Only recommend products from a trusted brand with verified third-party lab results and transparent manufacturing and extraction processes. Be sure to monitor patient liver enzymes to avoid any potential risk of toxicity. Assist patients with proper dosage form and titration to ensure a clinical effect and minimize side effects. Always keep in mind that a full-spectrum medical cannabis product may be necessary to achieve optimal results. This concludes the Hemp CBD Learning Module. Thank you for joining us.